This is the gluteus maximus test. So we're going to have the patient go into knee flexion. We'll start with this side, knee flexion, and then hip extension. So we're testing gluteus maximus, which originates on the posterior sacrum, the ilium, the superior gluteal line, inserts on the gluteal tuberosity and IT band, and its action is hip extension and external rotation. So have them here. All right, hold that position, and then don't let me break you. 1, 2, 3, 4, 5, relax. This side, do the same thing. Hold here. 1, 2, 3, 4, 5, relax. This is the gluteus minimus test. The gluteus minimus originates the posterior ilium in between the inferior and middle line, and it inserts on the greater trochanter on the anterior side. And its action is hip abduction and internal rotation. So when we do this, we want minimum movement. So we're only going to put them into minimum abduction. I'm going to force them into hip adduction. Ready? 1, 2, 3, 4, 5. Relax and compare bilaterally. Hold here. 1, 2, 3, 4, 5. Relax. This is the gluteus medius test, where the gluteus medius originates the iliac crest in the anterior gluteal line, and it inserts the lateral greater trochanter. So its actions is hip adduction and internal rotation. We're going to have the patient go into abduction and slight hip extension, and we're going to try to force them down into hip adduction and hip flexion. Ready? 1, 2, 3, 4, 5. Relax and flip sides to compare bilaterally. Side line, straight line. Ready? 1, 2, 3, 4, 5. Relax. So this is the hip adductor test. It tests 5 different muscles. The first is gracilis, with an origin of the pubic symphysis and the inferior pubic ramus. It inserts at the pes anserine. Its action is hip adduction, knee flexion, and hip internal rotation. The pectineus has an origin of the anterior pubis. It inserts the pectineal line of the femur, and its action is adduction. Adductor longus has an origin of the pubic symphysis and inserts on the linea aspera. Its action is hip abduction or adduction and internal rotation. The adductor brevis has an origin on the pubic ramus. It inserts linea aspera, and its action is hip adduction and internal rotation. Lastly, the adductor magnus originates on the pubic ramus and the ischial tuberosity. It inserts the adductor tubercle, and its action is hip adduction. So what we're going to do is we're going to test the lower leg. So we're going to have the patient cross his leg to this side. Make sure he's lying in a straight line. His head is tucked underneath of his arm, or with his arm and elbow. We're going to have the stabilize up here, and then we're going to have the patient go into adduction and tell him that we are going to push him down, so to resist us. Right, so straight line, bring it up, don't let me break you. 1, 2, 3, 4, 5, relax. And then he would flip to the other side and compare bilaterally. Flip to the other side, cross this leg over. This is a straight line. Bring into, relax, adduction. Ready? Don't let me break you. 1, 2, 3, 4, 5, relax. So this is the hip flexor manual muscle test. And this one specifically is testing rectus femoris and the iliopsoas. So the rectus femoris, like we said, has an origin of the AIIS and right above the acetabulum, the superior groups, the acetabulum, and then inserts tibial tuberosity, and we said that its action also included hip flexion. And then we have the iliopsoas, which is a combination of the psoas major and the iliacus, which originate the iliac crest and fossa and the transverse processes of T12 through L5, and insert at the lesser trochanter of the femur, and its action is hip flexion. So we're going to have the patient sit off the table. We're going to have his leg come up into hip flexion, and we're going to support his lower back so he's straight up, and we're going to try to force him down into hip extension. Ready? 1, 2, 3, 4, 5, relax. And the same thing on the other side. 1, 2, 3, 4, 5, relax. This manual muscle test is another hip flexor group, except you do not include rectus femoris in this one. It's just the iliopsoas. So we have the patient go into hip flexion and slight abduction. So we're going to support, we'll do this side first. So slight abduction and toes out. So then we're going to support the other ASIS, and then we are going to force into extension and adduction. Ready? 1, 2, 3, 4, 5, relax. And do the same thing on the other side. Toes out. 1, 2, 3, 4, 5, relax.
This mini muscle test is for the lateral rotators. So you're going to have to laterally rotate the femur. You're going to put your hand on the lateral side of the knee and the medial side of the ankle. Have them try not to break. Ready? 1, 2, 3, 4, 5, and relax. And test by out laterally. 1, 2, 3, 4, 5, and relax. Alright, this mini muscle test is for the medial rotators. You're going to have the patient medial rotate outwards, and then you're going to put your hand on the medial side of the knee and then the lateral side of the ankle, and then I'm going to push in, try to have me not break you. 1, 2, 3, 4, 5. Relax. Test bilaterally. 1, 2, 3, 4, 5. Relax.
Alright, now we're going to test the TFL. Its origin is the iliac crest and the ASIS. It inserts on the IT band or Gertie's tubercle. And the action is hip abduction, flexion, and internal rotation. So I need you to lift up your leg, hip abduction, and internally rotate. So let me break you. 1, 2, 3, 4, 5. Relax. Go there bilaterally. Same thing. Ready, go. 1, 2, 3, 4, 5. Relax.